So with that, I'm going to turn this over where I'm going to invite Quantum to showcase their services and how they help employers meet the needs for their benefits and their employees. So this will be presented by Sarah Simmons Schreiber, and you want to talk about Quantum Health for us? So.
Sure. Thank you for the introduction, Marianne. So I'm going to spend just a couple minutes grounding us and talking about Quantum Health before I turn it over to my co-presenter, Alexis, who I'm really excited to introduce. She and I worked closely together during her evaluation of navigation solutions a couple years ago. So I think her session will be very well received, and she has a lot of insight. So Barry Way Miller is a very interesting company. So first and foremost, with About Quantum Health, we were founded 21 years ago and the leader in the consumer navigation space for self-insured employers. So we are proudly serving over 1.5 million consumers and helping guide them through their healthcare journey. We also have a very diverse portfolio of customers. So currently serving over 220 clients that span a very broad spectrum from industries, different geographies, different sizes. But what they all have in common is the need to deliver an exceptional experience for their members and their families, and also to control costs. Additionally, we've been delivering industry-leading cost savings and satisfactions for both employers and members. And you can go to the next slide, Michelle. So if we focus in on the results and outcomes piece before we dive into navigation, we are uniquely positioned that we send our entire book of business data out to an independent third-party actuary to validate the financial outcomes that we consistently deliver to our customers. So we've been doing this for 18 years. We're not cherry picking customers based on their size, based on their outcomes. We are sending all clients, big and small, out to have this validation. And so we have that earmarked for the last 18 years and can show those consistent, sustained savings. But really where I would like to start from a results perspective is within the satisfaction realm. So we really believe that if you are able to earn the trust and provide a great experience for employees, that's really going to end up garnering long-standing, meaningful engagement. So we are measuring our Net Promoter Score for the consumer, for the end user, which we have at 76. So again, on a scale of -100 to 100, our members are ranking us at a 76 consistently. Our client Net Promoter Score of 77. So again, helping them achieve their individual goals. And then also measuring the provider Net Promoter Score of a 74. So the provider piece and the provider relationship is an absolute critical component to our model and establishing a holistic structure so that we can really help that consumer through their entire journey from end to end. So then if we transition to engagement, and then just very quickly, our definition of engagement is an active two-way interaction. So again, that could be telephonic, it could also be digital, but it can't be passive. It has to be a two-way dialogue. We have engagement with 84% of households, 95% of members with claims exceeding $10,000. And we're also seeing an increase of 2 times point solution engagement. So again, connecting people to the different benefit assets that their employers have invested in. So with long-standing engagement, we're able to achieve outcomes. So if you want to go to the next, thanks, Michelle. The next segment, we see a 16% increase in preventive care. And our clinical quality measures are 7% above those national norms. We also see a decrease in inpatient days. So again, it's that whole collaboration that we're establishing with members as well as their providers. And then finally, from a financial perspective, so if we're able to have that long-standing, meaningful engagement, and we're also able to control and impact outcomes, we're also able to achieve the savings. So we see a cost reduction in year 1 of 5.7%, cumulative savings of 9.2% by year 3, And then finally, by year 4%. So it's absolutely critical, ongoing, sustained savings for our entire book of business and customer base. And so, oh, and next slide.
Thank you, Sarah. That was great. I appreciate that. We're going to start our first session of day 2. And the title is Simplifying Healthcare Through Navigation, Transparency, and Advocacy, Helping Employees Navigate a Complex System. This should be pretty interesting, and Sarah Simmons will be one of the speakers. You can hear out the bios, and I'll just briefly mention about Sarah. She wears many hats at Quantum Health. She's the Vice President of Sales, and not just an integral member of Quantum Health's client-facing team, but she also weighs in on company decisions and market strategy as a member of the senior leadership team. And she assists the growth of the sales presence by planning for other teams within the sales organization, and also paves the way for a new sales leader. She's joined the Quantum team as an account manager and quickly ascended to client executive, and after a few years became director of sales operations prior to her current role as vice president of sales. We have another team member here. We have Alexis Weigand. Oh, let me say this right, Alexis. I'm sorry to brutalize your name. Alexis Wigmund. She is the health and well-being leader at Barry Waymiller. That's a privately owned global supplier of manufacturing technology and services, serving a diverse platform of industries: packaging, paper converting, sheeting, corrugating, engineering, and IT consulting. In her role on the culture and people development team, Alexis leads the programs and initiatives that provide support for Barry Waymiller's team members and their families as they navigate the complex healthcare system and their own personal well-being journeys. Her primary focus is to develop partnerships and programs that support her team's vision of sending all team members home feeling safe, well, and fulfilled. And then our third speaker is Adam Johnson. He is the Vice President and Head of Health Strategy at Alight Solutions. Adam is responsible for Alight's healthcare navigation solutions and strategy that are designed to improve the cost, performance, and experience of employer health plans of all sizes. And over the last decade, Adam's teams at Compass, which was acquired by Alight in July 2018, built the leading healthcare consumer navigation platform in the industry. Adam is focused on growing Alight's navigation solutions and developing innovative and integrated healthcare strategies for the broader employer, government, and health plan arena. And with that, I'll turn it over to the three of you. Thank you for being here today. And I'll remind our attendees that they should, if they have questions or comments, please use the Q&A box or the chat box at the bottom of the screen. Take it away, Sarah.
Great. Thank you again, Mary Ann. So I have a couple quick comments before I turn it over to Alexis, but just to ground us in the foundation of navigation. Over the last couple decades, employers have really tried to solve for a few critical challenges. So increase healthcare costs, creating an exceptional experience and guided experience through a pretty complex healthcare system, and then also maximizing the investment and many of the benefit assets and solutions that they have put forth for their employees as well as their families. So I'm using in this illustration, it is Quantum's structure from a navigation perspective, but just understanding that there are quite a few other solutions that are in the navigation landscape that are a very broad spectrum. Some of them are digital first, others are completely consumer centric or member centric. But just to walk through how navigation is structured with the goal of creating an exceptional guided experience for the healthcare consumer. So Michelle, if you want to build this one out, I know we've got quite a few in here. Thank you. It might be a little bit easier. So really creating a point of entry for consumers as well as providers. And so this is done in a couple different ways, but creating a point of contact, whether that's telephonically, through a digital solution, whether that's a mobile app or a web portal. And then also hosting or assuming responsibilities such as member services, provider services, and then also providing clinical and care coordination solutions. So with the goal of creating a holistic experience where that person, that healthcare consumer, has a point of contact from end to end, whether that is something as simple as basic blocking and tackling with benefits questions, with claims issues, with finding a provider, all the way to very detailed, complex issues surrounding a clinical experience that maybe they're having or a family member is having. So again, creating that point of contact where they truly have a trusted guide that they can go to for the full spectrum. You know, at Quantum, we are leveraging those seemingly transactional questions from consumers as well as providers as really an unlocker to understand what's coming up next in their healthcare situation. So while providing these services, we are also partnering very closely with others in the benefits ecosystem. So making sure that we are marrying the real-time information and data that are coming from those conversations, as well as the incredibly important information that we are pulling from claims administrators, as well as network information from the pharmacy benefit manager, also from point solutions. So there are so many other great solutions that are out there and available for employees and their members that might be very laser focused on specific conditions or solving for a specific issue. There's excellent data and information. So not only is the navigation solution able to, at the appropriate time, introduce these solutions, which again is maximizing the engagement of those solutions, we're also able to come full circle and leverage the data and utilization patterns within those solutions so that we can really see the full picture of what's going on with the member at that time. And then also connecting to community resources. We know as employers would love to offer and cover everything under your health and benefits plan. Sometimes that's not always possible. And so having a trusted guide who has eyes to other solutions in the community, we are able to eliminate barriers, address the social determinants of health by connecting them to those community resources. And then again, you know, being that platform for all benefits, you know, understanding that someone who is on a clinical journey or a healthcare journey isn't just isolated to their medical benefits. There are other things such as leave and disability, you know, even critical illness. There are other levers that we can pull to help eliminate any of those challenges. So as we go through the day, we're going to talk through Alexis's examples of what she's gone through just in terms of navigating and creating a best-in-class experience for members. So Michelle, if you want to go to the next slide. So Alexis, I was telling everyone before you joined, it's exciting to present with you again. I got to know you during the evaluation process of navigation, so I'm looking forward to speaking with you today. So Alexis is with the Berry-Wehmiller companies. We love having our clients tell their stories, and we hope that you'll benefit from hearing Alexis share how navigation has been essential to their healthcare benefits. Thanks, Michelle. So Alexis, before we get started and we dive into the navigation piece, can you take a moment and tell us a little bit about yourself as well as Berry-Wehmiller?
Sure. So I've been with Berry-Wehmiller for about 8 years now. And Berry-Wehmiller is a $3 billion global supplier of manufacturing technology and solutions, serving a diverse platform of industries, packaging, paper converting, sheeting, corrugating, engineering, and IT consulting. And my role is primarily focused on health and well-being programs for our team members. And we really aim to provide the best possible experience and care for our team members. We have close to 6,000 team members here in the US and 11,000 globally, primarily focusing for our benefits on those that are here in the US. And one of the things that we really want to prioritize is ensuring that Quantum Health is available to everyone in the US for free, not just those that are medically enrolled.
Great. Thanks for the background, Alexis. So if you take a step back a couple years ago and you think at the beginning of your journey in evaluating solutions, what problem were you trying to solve with navigation?
Yeah, so we were really facing the issue that everyone faces. Our team members were confused. They didn't really know how to access their healthcare, the healthcare system, and they didn't really know what steps they should be taking, who they should be calling. We had a lot of different points of entry into the system and with all of our different benefits partners, and so they were just really confused. We previously had Cigna as our partner. And so, calling into the healthcare system and not really having that, high touch partner in place of helping navigate that process with them and not really knowing where to turn, that was something that was just really prohibitive to the process for our team members. And, we were also facing skyrocketing costs for our team members, and we really were having trouble getting all of that under control. And so we were looking for a partner to help find that navigation piece to get that under control and getting a lot more of that functionality in place.
Great, that's helpful context. So now if we flash forward to current state, how has navigation helped your business and your employees?
So we always want our team members to know how to be the best stewards of their healthcare costs and what they need to do in the moment. What we really hate doing is talking about cost from a healthcare perspective, but realistically, it's really helped navigate cost and mitigate risk. And our team members feel so much more cared for now that they have a real partner. Before they really felt alone on an island. And something that we've always really talked about with them is talking about shifting the conversation from cost to caring for our team members. And so navigation has been truly critical, and we've seen really high engagement with our navigation partners. And, we have a really tough demographic. Our demographic is manufacturing. Our average age is 50, and we have less than 1,000 female employees. So our employees are generally older, but they're highly skilled manufacturing male employees. And they're working with heavy machinery all day long. So they have very small windows of breaks, and we need partners in place that are available whenever they have those small windows. They can call that resource and get answers quickly, because they don't really have time to sort of dig in and try to find the answers themselves. Also, it's not an issue of them trying to figure out and understand. They're highly skilled. They are very knowledgeable, but we just want to know that we just know from our research that the more engaged member of the household is usually the spouse. The male employees aren't looking through our benefit guides. I don't know if anybody else has that experience. But generally, it's that our spouses at home are the ones that are way more knowledgeable about our benefits than our actual team members. And so making sure that we have a partner in place to help them navigate that is really important for them to be able to just call and get those questions answered. It's also instilled a huge amount of trust in us. Our internal team, our HR team, putting that partner in place, that we care enough about them, that we're trying to make this easier for them and not just throwing all of these benefits out there and just expecting them to navigate this all by themselves. It's also helped a lot that they understand that we do truly care about the experience that they're having.
So, and Michelle, if you want to go to the next slide, but Alexis, just with our next question. So knowing that experience is absolutely critical for you and your team and just the employee experience, do you have any stories that you can share that help highlight what you just talked through?
We have so many stories. We have some really incredible stories. And one of the most touching for me personally as a parent is, we have a lot of situations of team members that have small children with cancer diagnoses. And, you know, one in particular came forward, and I can't imagine being the person that's in that situation and how overwhelming that must be, and not knowing where to turn, and trying to navigate that process. And, you know, a lot of the different doctors coming forward and talking to you, and who are you supposed to turn to? And so the team member came forward to tell us how having that partner in place to help hold their hand through that process and guide them through that, I mean, that made everything so worth it to us, because I can't imagine being put in that type of situation. And so having that confirmation from the team member that one of the most horrible things that you must be going through in your entire life, that you did have that confirmation of a solid partner in place to help make that a little less miserable, that was great to hear from our perspective.
Thank you for sharing that story, Alexis. I appreciate it. So to slightly pivot, I know that there are some unique benefits of the navigation from a data perspective. Can you share those, and how does the data that you get back from vendors help you and your team in making decisions?
So we always use data to drive our decisions, to understand where we have room for opportunity and where we need to focus more closely. And if a lot of people are calling forward with issues about a specialty pharmacy, it's great to have you know, that feedback coming directly from the partner, so that we understand if there are certain roadblocks in place. And, you know, we really weren't getting that type of feedback before about certain situations. And so being able to have that type of give and take partnership is really important to understanding what is it that's really truly going on with our team members. And so, you know, a lot of times you have situations where there's loud and noisy team members coming forward with issues and everything like that. You hear it sometimes from the field, but you know, it's only the really loud and noisy team members that will come forward. It's not the day-to-day, but having that partner who's able to say, you know, we're getting a lot of calls about this type of issue, and we know it doesn't necessarily have to be this way. And so that's really key to being able to get that feedback that we wouldn't have had before.
Michelle, if you want to go to the next slide. So Alexis, as you had mentioned earlier, just your population is very dispersed. What are some of your best practices for communicating benefits to your team members?
This is our #1 challenge across our organization, and I'm sure this is the #1 challenge for many people. We always have to have a multi-pronged approach because of our demographics. You know, we have people that are in the manufacturing environment, but we also have people that are sitting at a desk every day in an office environment. And then we do have some people that are out traveling across the field, traveling to customer sites. And so we have to have posters, emails, letters to the home to hit that spouse at home who's making the decisions. We have to have talking points for stand-up meetings. And so as we talk about benefits, we always have to think about the approach and approach it from the perspective of what's in it for the team member, and not just talking about another benefit to improve the bottom line, because if we just talk about it in that way, they're not going to pay attention. And we really want to avoid talking about the cost of the company instead of really focusing on the care. Because our CEO, Bob Chapman, wrote a book on truly human leadership, and the concept that we must treat all of our team members as family members. And that's really at the core of every single thing that we do and every decision that we make. So as we're thinking about benefits, we really do have a more aggressive cost share strategy. We push more cost to the team member than some other companies do. And we have to explain why we're coming from that stance. And we do this to make sure that they have a long-term employment. But also, because we have higher costs, we're able to do things like have navigation partners and really explaining that, you know, yes, there's there is a higher cost share and everything, but we're able to bring in more partners for them, and that this is because we're making sure that we're having the right partners in place for them in order to make sure that they get the care that they want and that they need. And so our communication really is truly focused about care and the real benefit to them and why they should be engaged, not only for themselves, but for their family. It's not based around how it improves the business or the bottom line. It's truly focused on the team member and their family.
Thanks. Michelle, next slide. So Alexis, knowing that we have quite a few employers and individuals that are in your shoes, any lessons learned or advice that you would give to others that are looking at navigation solutions?
One thing that we learned really early on is that the hook is so important, helping people understand why navigation is so important. You have to get them to do that first. And so that they actually reach out. If you don't help them understand why this is important to them and what's in it for them, then they're not going to engage and they're not going to have that first reach out. And so if you have some sort of pull in it for the team member to get them engaging right from the start, that's going to be the most important piece, because navigation is so beneficial for everyone. It's not just for people who have a lot of critical situations going on with their healthcare. I do not have anything critical going on with my healthcare, but I love my navigation partner. I love reaching out for talking about doctors and everything. I think it's so helpful to ask, just different questions of our care coordinators and everything. And, I'm in benefits, but I still reach out and ask them questions. But, once you get that first connection point in, they're going to keep on going back to them with engagements. All of our numbers show that it's not just that people are reaching out once and then they're never engaging again. You have people with multiple engagements. And so what we've really done is we've baked navigation engagement into our medical premiums. And how we've done that is having the initial registration with Quantum as part of a requirement of lowering your healthcare cost each year. And it's called our Better You incentive. And so by taking certain actions throughout the program year, you can save a good chunk of money off of your medical premiums each year. And so one of those requirements, another aspect of the requirements is completing age and gender appropriate screenings and everything. But one of the requirements is getting registered. We call it Get Connected to MyQ Health. And that's because we just want them to go out and initially get registered. So they just have their contact information in there so that Quantum can start contacting them and get started with them. And we think that this is so important to encouraging them to completing the right steps and getting that first step in the door to getting all of those next steps really completed.
Thanks, Alexis. So one final question. So we at Quantum Health believe that navigation is essential. So this is a fill in the blank question, essentially. So to you, if you had to fill in the blank, how would you complete the sentence, navigation is blank?
Navigation is critical. This is a critical piece to our healthcare delivery model for our team members. We would never entertain a world without having navigation in place from here on out. It's really a non-negotiable for us, and even our senior leadership team would stand behind this statement. It's really important for us. And we also talk about this all the time when we're talking with other companies and peers throughout the community as well, because we really do believe that this is the missing link, and we truly stand behind that this is a really important piece in the success of our engagement in our numbers and the impact that it's made on our healthcare cost.
Great. Thank you, Alexis. And thank you so much for joining me today. We really appreciate you and your time. And of course, your partnership and being part of the Quantum family. So Michelle, if you want to go to the next slide.
Thank you, Sarah and Alexis, for this very interesting description. Before we switch over to Adam with a light, I just have there was one question in the chat box that asked about what is the dollar value of the premium discount and who administers it? Is that something you can answer, Alexis, or maybe you, Sarah?
Yes, so the dollar value that we do is we say at least $1,200 or at least $2,400, and that's really based on if they have single coverage, if it's just the team member who elects medical premiums, or $2,400 in savings a year for a family. And again, that might seem really high depending on what your medical costs are per year. But again, we have a little bit higher of a cost share. And it also is based on, we have our medical premiums based on salary tiers as well.
Mm-hmm.
And it's administered by Quantum for us.
Okay, that's helpful to know. Then one of the questions I had is, I know you're obviously working with a health plan as your third-party administrator, assuming you're self-insured. How does the navigation service, and Sarah, chime in as well, integrate with the health plan and the services offered through the health plan and some of the other ancillary vendors? For example, if you have a specialty pharmacy separate from the health plan's pharmacy, or if you have the mental health services, EAP, and so forth. But I guess I'm mainly curious how this integrates with the health plan.
Alexis, I can jump in if you want to add color too. So the way that this is structured is Quantum assumes all responsibilities from a member and provider services. So we truly become the single point of contact for members and providers for any questions related to medical as well as pharmacy. We are also performing all clinical responsibilities too. So anything from case management, disease management, we have a primary nurse model that we employ, and then also from the utilization management function. So a member and provider would not contact the claims administrator in this case. Everything would go through us, again, just to create that simplified experience. And then, as I had mentioned earlier, making sure that we are able to leverage those conversations as early intercept points of someone who is either starting a healthcare journey or maybe taking another step in the healthcare system. So we do work closely with any other benefit assets. So for example, EAP. So understanding the full scope of benefits, connecting through digital functions, but then also proactively educating individuals that they have these resources and benefits available to them at a time where it's most relevant. And also partnering with the specialty pharmacy if that drug is going through that mechanism. So Alexis, I don't know if there's anything else that you would add.
No, I wouldn't add anything else. I think that sums it up.
Okay.
I did see one more question come through the chat about communication methods. What communication methods have we found work best with so many team members and their spouses and partners? And so when we're really trying to target both team members and our spouses that are at home, we do always make sure to send home a mailer to the home whether it's a letter, a postcard, in some sort of fashion. And, you know, if it's something that we have to make sure that they're actually reading and they're not just going to throw in the trash, we try to stay away from a letter format, because we found that if it just looks like a plain letter sent to the home with like our logo right at the top or something, like it just looks like a regular letter, that they're not actually as likely to engage with it. And so our communications team has gotten a little bit more creative over the past 5 years. And so we've just done postcards now. So now we don't have to rely on them opening up letters anymore, and it's just the postcard. So they can actually like look at it when they pick it up, and that's actually made a huge difference. So it might seem silly and kind of not kind of common sense, but postcards are probably our most effective mailers to the home.
Yeah, I imagine they'd be pretty effective, but then the high-tech solutions as well, I suspect. I don't know what your demographics are for your workforce and how many are working at home, but I suspect that, do you have some working from home? Or some?
Right now, we have a huge population working from home. But in normal times, we don't actually have a huge work from home population. I would probably say less than 10% of our team members work from home in normal times. So it's really not that high.
Okay, yeah. Well, just moving into, the high-tech communications seems to be pretty popular, especially with the younger people. So it's great that you're kind of combining all of that.
Yes.
Yeah, that's great.
We have to be flexible.
We have to, yeah.
Yes.
Communication is key there. So I think it's wonderful for your employees to have access to that sort of a service. So that's great. Good decision.
Definitely.
So thank you very much for sharing your information, Alexis and Sarah. What I'd like to do is now turn this over to Adam Johnson. I've introduced him a minute ago with a light, and